When I talk to her about what she's got coming up, she can no longer trust, is that the right date? Was that the right time? I don't remember that. You know, there will be lots of cross-outs. You can't make heads or tails out of it. We're in this week here.
I know.
What day are we at?
Tony Estrella's mother, Donna, has Alzheimer's, a disease that attacks the brain, destroying one's ability to think and function.
On some level, you know, Alzheimer's is a kind of death in life when your mom or your dad no longer recognizes their son or daughter.
Come on in.
Okie dokie.
Donna is taking an experimental drug, hoping to stave off dementia.
That same area on the covering of
The companies testing Alzheimer's drugs have their own hopes. An effective treatment will not only help patients, but bring in billions of dollars. Its scientists designed a selective phase 1 safety trial, hoping to get clearer results.
what we're really looking for is...
Instead of treating moderate Alzheimer's, Biogen only enrolled patients like Donna with mild or early stage disease. And they scanned every patient to be sure they had plaques that their drug could target. The results were promising.
It appeared that the more drug that was given, the more amyloid plaque was removed from the brain. And the longer that person was on the drug, the more plaque was removed.
So we believe we have proof that our drug is getting into the brain and attacking the plaques and reducing them. Having done that, the next step is really, does it matter? Does that contribute to improvement in cognition?
Now, I'm going to show you a few common objects.
Although the primary aim of the study was to test the drug's safety, Biogen also gathered cognitive data.
What is this?
Pacifier,
What is this?
screwdriver.
And what is this?
Oh, that's a good question. I don't know. I know what it is.
With
but
only 166 patients in the study, it was too small to draw definitive conclusions. But a signal did emerge.
Objects, right? Can you tell
And there we saw that lowering amyloid in the brain of mild patients correlated with a slower decline in cognition, especially for the highest dose of the drug.
In contrast to patients on placebo, those taking the high dose declined some 80% less on cognitive tests. But there were side effects.
Things like edema or swelling in the brain. So many of those patients had to drop out.
Going to do a temperature here, okay?
So it's something we want to avoid because we have to make sure people don't develop any significant damage from the amyloid removal. And unfortunately, this side effect will limit how much of these antibodies we can give to people as we're trying to help their brains remove the amyloid.
For Tony Estrella, the risk seems worth taking, especially if the trial leads to a successful drug for his mother.
What,
Right.
Where is that arrow? Can you tell me where that arrow, what that arrow is
I just-
connecting?
It's connecting from 11 to 9.
So you think you changed it from 11 to 9. That's why you crossed out the 9.
I don't know.
You're looking for a lifeline of some kind because it's unknown territory. And so with that comes a certain amount of fear about what's going to happen to your mom. And all of a sudden you can't help but think about yourself as well. Probably in this week you picked the right week. And my grandfather had Alzheimer's as well. And so you think about, well, this is, you know, this isn't going to stop here, which makes this trial so important.
Betting that the side effects can be managed, Biogen is taking the gamble and jumping directly to phase 3 trials, treating thousands of patients.
We are in the midst of testing a hypothesis that the world has been challenged to test. We think this is a very viable target. It may not be the only target, and huge investments are at stake. A lot of time and efforts at stake.
We're looking for a signal, somewhere a signal that would show that we're on the right track. And in the last couple years, a small signal is beginning to emerge, suggesting that these antibody therapies may provide us with a treatment.
The key to success appears to be giving these antibodies early.
You look great.
Risa Sperling thinks clearing plaques from the brains of baby boomers might avert an epidemic.
And I heard that
She's running a preventative trial for people at risk for ordinary Alzheimer's using a drug developed by Eli Lilly. In past trials, it slowed memory loss 34% in mild Alzheimer's patients.
You know, if you want to stick your head in the sand and just say, well, whatever happens, happens.
I want you to just step on up. I want you to
So
have a
yes,
seat
it's
right
high
there.
stakes for all of us who are going through this whole process, but at the same time, there's the potential of what they might find and whether or not the meds will work.
Keep your eyes nice and closed for me.
While preventing plaque buildup may keep Alzheimer's at bay, Sperling suspects this approach won't help everybody.
Just a little bit like that.
Especially as the disease advances, and another culprit, identified by Alois Alzheimer over a century ago, begins to wreak havoc. Tangles.
It's been known that two different changes happen in the brain of people with Alzheimer's disease. One is the buildup of amyloid into plaques, and the other is what we call tangles that accumulate inside the nerve cells.
Tangles are made of a protein called tau, which helps stabilize neurons and allows them to communicate. Yet in Alzheimer's disease, tau is corrupted and twisted into tangles. As tangles form and neurons die, the symptoms of dementia set in. But why does tau go bad? Insights are coming as new advances let scientists image and track tau in the brains of living patients.
So the first thing we found when we started to look at tau scans is that almost everybody over the age of 65 or 70 has some tangle buildup very deep in the brain.
Now, these are still normal people, but at a certain point in some individuals, the tau just is transformed. It tangles, it proliferates, it propagates into other places in the brain. It just spreads like crazy.
And the reason becomes obvious when amyloid and tau scans from the same person are compared.
In Alzheimer's disease, people don't get tangles spreading throughout their brain unless they have amyloid. So currently we think that amyloid pulls the trigger and tau is the bullet that unfortunately kills the nerve cells.
And when that happens, now people begin to get demented. So if we're going to have a treatment, you can't ignore tau. This is a complex disease that needs a multi-pronged attack.
Now we're seeing the first drugs going into clinical trials to stop the tangles from spreading. But we don't know what problems they're going to see. Coming up with the right therapy that's safe, gets into the brain, it's potent, hits the right target. This is part of drug discovery. It's incredibly hard.
As tau drugs enter testing, Genentech, Biogen, and Lilly await the results on their antibodies targeting amyloid. Even if they slow dementia, they will not be silver bullets or help everyone. Still, experts predict we may see the first drugs to treat the cause of Alzheimer's by 2020. But progress also depends on getting people to join clinical trials.
It really is a very promising time for the field, and I think that's one thing that patients should keep in mind is that if we can enroll these trials in half the time, we get the answers much, much sooner.
There's only one way out of this problem, and that's research. And the research community is really active, and the insights are coming rapidly. And that is where we're going to get an answer.